hospital or a public hospital. So what I wanted them to do was not only make a presentation or case presentation on a PowerPoint slides set, but also in conversational style, like it is carried out in the discussion for a long case, so that they become aware of various aspects of history taking and history presentation, and similarly of physical examination and narrating their findings of the physical examination, and then coming on to a diagnosis, and then further on to the management. So therefore, the format was a little changed one, and it did not involve presentations. That was one reason. Second reason was that my impression was that most of the participants on the net, they had already gone through that, and they were fourth year residents who were preparing to take their examinations, final examinations, and for them it would have been rather a preliminary or basic kind of discussion. That's why we kept it off the net. That was one reason. But just this morning, I am coming from a virtual meeting, which was arranged by South Asian Federation of Obstetrics and Gynecology in collaboration with American College of Obstetricians and Gynecologists. And they are going to have a session, a simulation session on 27th of this month. And the people who would be conducting that simulation session are from quite eminent universities. One is from Stanford University, and another is from University of California at Los Angeles. So both these universities are prestigious. One is an American, white American, and one from UCLA. She is an Indian young professor who got promoted only on 1st of July. But I was roped into this activity by Rubina to spearhead the candidates who were to take part in that activity from Pakistan. And two postgraduates were nominated who are to prepare and who are to take part in this simulation. But others on the net can participate and can be part of it. Not part of the discussion, but they can probably observe and all that. And I think that will be a very useful activity. The topic for that is hypertensive pregnancy management. And today, the American team, the senior team of professors, they made a presentation of about 30-35 slides of what this simulation exercise would be composed of, and how people would be working on that. And that was quite informative. As more information comes in, because we are going to have a couple of runs of this, or practice runs for the final activity earlier than that. But I think that will be useful. And if it were possible, then I will share the link to most of you who are on the net with us, and so that you can also be observers for that simulation activity, in which people will be, or those who are active participants, they will be asked questions, and they will be taking part in the discussions, etc. So I think that's going to be an important exercise, and we then obviously can design our own, or we can design our own, and then carry that on various subjects. Now, so far as the residents over here are concerned, I was going to tell them after that this morning's meeting of with American College, that there are various aspects to postgraduate learning, various components, not necessarily in the order that I am going to talk about. You can say number one, number two, number three separately, but one prerequisite is that there should be theoretical knowledge, that you should know, you should understand those areas theoretically before you can discuss, because until and unless you know the theory, you cannot talk about it, you cannot apply it on the patients. So the basic ingredient, the essential beginning ingredient is the theoretical knowledge, for which you should have basic textbook knowledge of the subject of the various topics and a comprehensive knowledge of that. So that is the number one prerequisite. Number two is acquisition of skills. There are procedures that we do. We do not sit around the table and only discuss the theory. We carry out, we manage patients, we carry out certain procedures, we manage patients in not only prescribing them or giving them prescriptions of drugs or order them to have some investigations. We also perform certain procedures, starting with physical examination of the patient. That is something which is part of every specialty, even dermatology. You cannot just talk with the patient and not examine, and probably psychology is one in, or psychiatry is one in which you would only talk and not carry out the examination, but in that also there would be some aspects which would require examination. So first skills would be starting with physical examination, and of course general physical examination, systemic, etc., and so on and so forth. And then those parts of examinations which are peculiar to that specialty, like in ours, it is the obstetrical examination, the gynecological examination, and different parts of components of the gynecological examination. So that is the first set of skills that need to be acquired by the residents, by the prospective specialists, or even simple doctors. The third component, or the second component of skills, overall third, that would be of procedures, going beyond the physical examination. That is procedures. Maybe that is incision and drainage. Maybe that is normal delivery, conduct of a normal delivery, and even taking a blood pressure and all that. And then specifically the procedures, like minor procedures in gynecology, minor procedures in obstetrics, and similarly major procedures in specialties. And then those procedures, they take different routes. For example, some people would specialize into endoscopic procedures. The others, they would take another specialty like oncology or maternal fetal medicine. So these are the various branches then where you go on, and the skills will be then acquired according to that subspecialty that one carries out. Fourth component. So first is theory. Second is skills, and amongst skills will be the physical examination, procedures, and then the skills of cooperating, which will help that discussions. When we discuss a case, or their case is presented, what are we doing? We are looking at the theoretical aspects of the management of the patient, and deciding as what would be the best approach to address the patient's problems. So that is something which is another set of skills which is required. How do you do that? After having taken a history and examining the patient, having examined the patient, how do you carry out the management? Because that is the final thing which is required. So you have theoretical knowledge, you have skills for physical examination, you also have acquired physical skills for carrying out procedures, and then you have the skills of course, managing. How are you going to manage, and how are you going to put all those skills into a comprehensive kind of setting that would be required for the patient's management? And that completes the cycle. Now, if we start just with the discussion of management, that would remain a theoretical aspect. It will not prepare you, or it will not arm you with the skill set of managing that patients with your hands, and if that is something which is required. So I would emphasize that all of you, those who are even in the fourth year or going to take examination, they also must focus on these various areas, and try to assess for yourself that what are the areas that are deficient, so that you concentrate on that, and then uh, focus on that and acquire those, practice those, so that you attain a certain degree of proficiency in those areas. So that is what is is a kind of program that I would want our residents to go through. And since I was thinking about it just in the last few minutes, I thought that I'll share these thoughts with you. तो आज का तो सेशन जो है, अब टाइम तो हो गया खत्म आज, तो रिकॉर्डिंग खत्म कर दें अब बेशक, तो बाकी फिर हम इनसे बात करें। थैंक यू वेरी मच फॉर बेयरिंग विद अस।